Welcome back to Progress Therapy. If you haven't been here before, my name is Matt, one of the therapists here. We are a small group practice providing all virtual care to people with ADHD, anxiety, executive function problems, and other issues as well. Today, I want to tell you a little bit about how we began treating ADHD and executive function problems with dialectical behavior therapy. Now, just to give you a little history lesson, DBT was started in the late 1970s by Marsha Linehan. It was originally designed to treat borderline personality disorder. However, since it came out in the 1970s, it has shown to be effective to treat things like anxiety, depression, PTSD, and many other issues. So DBT is a practice that I've been using personally in my practice for a long time, and it's something we've always used at Progress Therapy. And so the way we started using DBT to treat ADHD and executive function problems actually started a while back in my own solo practice. I was often working with clients with anxiety and other issues, and over the course of treatment, they would begin to describe executive function problems or symptoms of ADHD. Some of them would report a diagnosis of ADHD. They would tell me that they were dealing with things like disorganization, procrastination, difficulty transitioning between activities, and all sorts of things. And naturally, I taught them DBT skills because the DBT skills that I was trained in were perfectly applicable to what they were describing. Although I was never taught in my training that DBT was explicitly for ADHD, I just wanted to help my clients improve their symptoms. And so I used the skills and tools that I knew would address their issues. And it became pretty standard for me to end up teaching DBT skills to people with these kinds of issues. And the best part about it was that these interventions were working. And so over time, I started to realize that this was not just one client or two clients, but many of my clients with these issues were benefiting from DBT skills. So from there, I actually started a DBT for executive function group. This is a 6-week group that we still run that teaches DBT skills specifically designed to address executive function problems. And even more than just our own experience at Progress Therapy, there is research that has come out and that continues to come out that is showing that DBT is an effective non-medication based treatment for ADHD and executive function problems. So now we have research and evidence that's starting to support this practice. DBT is a wonderful set of skills and tools that is effective for treating ADHD and executive function problems. I actually just wrote an article about this. I will link it down below in the description. If you're interested in learning more about Progress and what we do, go ahead and you can check out our website. This is also linked down below in the description. But that's it for today, and we hope to see you soon.